I'm Adrian Gobriel. We're inside e-Smoker Canada on Queen Street West, and big changes could be coming to vaping regulations here in Toronto, potentially the province, even the country. Today, the Board of Health voted unanimously in favour of recommendations made by the Medical Officer of Health. Though for the vote to have any teeth, both the feds and the province will need to jump on board.
The more we learn about vaping, the worse it gets.
All those in favour?
With their hands held high, the Board of Health put their support behind changes to the way e-cigarettes are sold in the city. As we told you last week on City News, the Medical Officer of Health called on Toronto, the province and the feds to prohibit the sale of flavoured vaping products in retail stores accessible to minors and set a limit on nicotine concentration. Though without the support of Queen's Park, as well as the feds, the plan could go up in smoke.
If the province doesn't get on board with the flavors in convenience stores, does the city have the power to take them out?
The city does not.
The ball is in your court. What are your plans?
I think all levels of government have a role to play. We are certainly going to fulfill our responsibility provincially, and we will be coming forward with a slate of provisions in January.
Ontario's Minister of Health wouldn't expand on what changes will be coming, only to say that they will be evidence-based. From 2017 to 2018, the number of 16 to 8-year-olds vaping increased 75%. Starting January 1st, the province will be banning advertisements in convenience stores and gas stations, though some believe it doesn't go far enough.
There is a bus shelter in front of every high school, has either Juul, Stilt or Vipe advertising on them.
However, a prohibition of all advertising would need to come from the federal government. Ontario NDP health critic France Jelena has tabled a private member's bill that calls on the Ford government to take the City of Toronto's recommendations one step further and restrict the sale of vapes to specialty shops only, though she isn't holding her breath.
Since this government has been in power, 0 private members' bill have reached the finish line. I want them to go from saying the right things to doing the right thing.
Now, the Medical Officer of Health's recommendations have been forwarded to the provincial government. Those you heard, we're probably not going to hear what they have in store until January. As we told you earlier on City News, Toronto's Board of Health voted unanimously to endorse vaping recommendations made by the Medical Officer of Health. Now, for anything to actually happen, the province and the feds are going to need to get on board. Now, here's one of the main concerns, as we touched on earlier as well, is that flavored vape products, they don't want them to be sold any longer inside convenience stores or gas stations, places where kids can get their hands on them. They're concerned about the amount of kids who are using the flavors like the ones we see here inside the specialty shop. There's pineapple, there's grape, kiwi, mango. Now, these flavors would only be able to be sold inside specialty shops like this one here that I'm standing in right now. We're inside e-Smoker Canada on Queen Street West. Though if the concern is about these flavors and kids using them or being attracted to vaping because of these flavors, why not ban them outright? Well, here's what Toronto's Medical Officer of Health had to say about that.
The issue is that, how do you try to restrict access? And we know that when you completely eliminate certain things, and we've seen this with other drugs as well, that what ends up happening oftentimes in an effort to try to limit harm, you sometimes inadvertently create more harm by pushing things into a black market or into illegal markets. So the real issue is, how do you try to balance what benefits there might be associated with this product to help people with smoking cessation, while at the same time limiting the capacity for harm to young people who have never used either regular cigarettes or e-cigarettes, and how do we stop them from adopting this as a new habit or practice?
The question would be, is it still going to be accessible to young kids who want to get it if it's still being sold in shops like this?
I will say, at least for us, I can't speak for everyone, of course, that we ID about any and everyone that comes through the door. If we have any question, just like the liquor store, we're going to ask you for your ID. If you can't produce it, unfortunately, we're going to have to turn you away. We have a lot of signage that sits outside the store that will tell you, if you don't have ID, if you can't produce a legal government issue document, then we can't serve you, unfortunately. Kids will obviously go to different extents to get the product, much like, alcohol or anything else. But we do as much as we can from our side of the counter to make sure that we're not turning it over to anyone that isn't legally allowed to have the product.
Now, if the Board of Health and Medical Officer of Health's recommendations are endorsed by the province and there's changes to the Smoke-Free Ontario Act, then only tobacco-flavored e-cigarettes would be allowed to be sold inside places where minors can access, like gas stations, like convenience stores. The province says they'll be making a formal announcement with their plans in January.